Well, one of the most common complaints I get from patients when they start noticing volume loss in their face is they come in and say, "It's this, I don't like these lines." What's actually causing these lines to occur is the fact we're losing volume in our cheeks. The fat pads start disappearing and going south, so the whole cheek descends, creating these lines. So one of the most important things I try to do with patients is to actually educate them about the loss of volume in the face before we start chasing lines on their face. Where we often will start then is by putting fillers deep to the bone on the cheeks to build up these cheeks again so that we can then address the finer lines around the mouth with other products. I think what gives people the most natural appearance of their face is to try to keep the symmetry of their face in mind and not to focus just on one area. So often people come in and, as I said, talk about this, but the real issue is you want to create a aesthetically pleasing ovoid shape to the face again. Anyone could overdo fillers. When you do that, it changes the symmetry of the face and makes you look unnatural. So the real concept is create a balance. The three biggest concerns people have when they have never experienced fillers is it going to hurt? Am I going to bruise? And am I going to look unnatural? So all those concerns, we have answers for those. As far as bruising, I think when you place your care in the hands of an expert injector, the likelihood of bruising diminishes greatly. If a bruise happens, we have a laser that we can use the next day to help break up a bruise, so it makes people comfortable that it's not a fearful thing. Mm-hmm. As far as pain, you can make these painful, but if you apply topical anesthetics that actually help to numb the skin, to numb up your injection points, it really becomes a almost painless procedure. Mm-hmm. And the unnatural part is something where, again, I refuse to take people to unnatural levels of fillers. I think it looks ridiculous, and I just do not want to take people to that level of fill. Expert injecting actually allows us to place product carefully, to actually minimize the need for excessive amounts of product being used. And I think the more you inject, and I've been injecting now for 15 years, the better you get at it. Mm-hmm. New Beauty Magazine just named me one of the top injectors in the country, and I think that shows that I have the skills and expertise to give people appropriate fillers. And in the United States right now, we have upwards of about 12 different fillers that are FDA cleared for use. They basically fall into two categories. One category are what I call the hyaluronic acid plumpers, which we use to plump up the lips, to fill lines. And then we also have the collagen stimulators. These are longer term products that we use to inject to stimulate your own collagen to create a longer lasting fill to your face. The amount of time between filler injections depends on what product is being used. As I've said, some fillers now have been FDA cleared for up to 5 years. That's the beauty of these fillers, is that once it's in, you're pretty much good to go for 5 years. I personally had Bellafill on my face now for 10 years, probably need a little bit more, but it's still amazing to see how it changed the way my face looked, and this has been over a 10-year period. The hyaluronics, based on the amount of cohesiveness and the cross-linking of the product, will determine how long that product stays in place. Mm-hmm. The other thing that really impacts fillers is the more you put a hyaluronic in a highly mobile area, the more quickly it will dissipate. Just the motion of that area, like around the mouth, will just move it out of place very quickly. People often ask if there are other areas that we can use products such as Radius, and Sculptra is another example, off the face. And I say to them, absolutely yes. Probably one of the most impressive treatments now that, again, has been FDA cleared is the use of Radius on the back of the hands. As we age, the back of our hands start belying our age. Mm-hmm. And what we do is we actually can inject the product into that soft plane of tissue that you can pinch off the back of your hand, and by doing that you can truly just eliminate that appearance of veiny, tendony back of the hands. It literally takes 10 years off the back of your hands. Sculptra could be used on the upper chest for people who are starting to get what they kind of feel like it looks like crepe paper changes on their kind of upper mid chest. Women hate this. We use lasers to tighten that tissue, but we can also use Sculptra injected in little microscopic amounts, and we just kind of carpet bomb the area with little Sculptra injections to stimulate collagen and help to smooth out the upper chest. Well, come join us on Injection Day. We're actually going to be using all three of the products we've just been discussing to really address the lines around the mouth, the volume loss in the cheeks, and of course the dynamic lines on the forehead. I am very eager to show you how that these can be used in combination to give you a very relaxed, natural, enhanced look. See you on Injection Day.